CMIO of Fairview Health Services. He just published a new book on healthcare data analytics. Thank you for joining me today, Ray.
Hi, how are you?
Tell me a little bit more about your book.
You know, what we wanted to do is get a number of experts in the field gathered together and try and do a primer of books. We figured this could easily have been 500-600 page, how to get started. And we really wanted to do a very quick overview for folks. If you go into the hall here, there's hundreds of individuals who are trying to sell analytics. We wanted to actually do two things. We wanted to show people what infrastructure they actually needed to build, regardless of what solutions they might choose, as well as look at a couple of different options of sources that could help them move forward. Actually, there's a third, and that is to use some science to demonstrate what has been done in data mining to show how analytics has made a difference in care provision in certain areas in healthcare.
Now, what are some of the big topics? I know that you mentioned infrastructure, and it's more of an introduction. But
so we kind of break the book into three different sections. So the first half is three or four different use case perspectives by different authors. Then we move into a little bit about the infrastructure pieces. What's the technical infrastructure you might need? What's the governance infrastructure that you might need, as well as what's the organizational infrastructure? Those are the three middle chapters. And then as we get towards the end, we look at one very specific example, as I mentioned earlier, and then we also talk about the HIMSS Analytics Delta model. Since HIMSS is getting into the service of trying to help organizations begin to grow their analytics program, we thought it was important that we highlighted that as one of the options that was available to folks.
Well, it sounds like a go-to source for providers, so thank you very much, Ray, for speaking with me today.